enforce accountability. They do not want to hear about some roof being repaired. They want to hear how the health system is going to impact them. That's what they want to hear from me, Mr. Speaker, and that's what I should be talking about. They want to hear why, when patients come to the clinics, they're being turned away. Should we, Mr. Speaker, our own brothers and sisters, should we, as they enter the clinic, be turned away because we have something else to do? No, Mr. Speaker, we must have some form of compassion. We would not want that to happen to our brothers, our sisters, nor our parents, Mr. Speaker. Mr. Speaker, these are questions the Bahamian public want to hear. No Bahamian public want to hear. The Bahamian public do not want to hear Michael talking about some chair or desk that needs some leg. They want to hear where are their medication, where are their doctor. They're not concerned about some chair or desk. That is not important, Mr. Speaker. They want to hear issues.
They can't sit on the floor.
Mr. Speaker.
They cannot sit on the floor.
Mr. Speaker, throughout our healthcare system, Mr. Speaker, especially in New Providence, we will introduce performance targets for all our staff members. Mr. Speaker, it's not unusual today that sometime a physician in a clinic setting may see 6 or 10 patients, or register 6 or 10 patients, and feel that that is all they need to see in an 8-hour shift. But yet, in the private sector, it's not unusual. If you are given 30, 40 patients, you would see them. But yet, in the government sector, you can see only a maximum of 6. That's not right. Mr. Speaker, I know, while writing examination as a medical student, during an exam as a medical student, you are given 20 minutes for one patient. If you would take that over an 8-hour period, that in itself is more than 6 patients. But at the same time, I remembered very well, during an exam, given that 20 minutes for a patient, at the end of 5 minutes, I'm finished. And I sit there wondering, I must have done something wrong. If the examiners allotted 20 minutes to me, why should I finish in 5 minutes? But no, Mr. Speaker, that's the realities of things. And if you can do that in an examination setting, when that is the most stressful environment at that time that you're going through, you most certainly can do better in a public setting. Mr. Speaker, performance targets would be placed not only on our physician staff, not only on our dental staff, but also on our clerks, so that so many records would be taken, so many records would be pulled, so that the physician knows that these are the amount of patients he or she must see, not 6, after which he or she must disappear. Mr. Speaker, we have had positive discussion with the Public Service Union. We've had discussions with the Nurses Union, and we've had discussion with the Doctors Union. And all unions agree that their members should be accountable. But they also agree, and we agree, that each member, each individual, should be treated with respect. Mr. Speaker, these performance targets would be placed and measures would be taken so that individuals and the supervisors can do the proper recording so that individuals can be disciplined. And if these measures fail, then obviously one can move to the introduction of a time clock within our institutions, within our clinics. Because our clinics, Mr. Speaker, is a one-set building where individuals are assigned to that clinic for 8 hours, a straight 8-hour shift. There's no reason to come at 10 o'clock and leave at 11:30. That is unfair to the Bahamian public. We must have performance targets. But we will treat each and every individual with respect, and only where basic protocols fail, then you would move to other targets where it introduce time clocks into our clinics. Mr. Speaker, the Department of Public Health should be client-centered service delivery structure. We have had, we intend, after discussion with the unions, we intend to commence workshop between our staff, especially our managers, supervisors, and the union, so that our managers and supervisors would understand and have a complete appreciation for the industrial agreement and how it's managed and how it's enforced, so that each and every individual would be treated with respect, and so that the staff member would likewise understand the agreement, and so that they themselves would know the rights that they have. But one of the big problems that you face within the health sector, and not only the health sector but outside, is that managers may not necessarily understand the agreement and the policies of disciplining individuals, and as a result of that, the whole entire system breaks down, resulting in the problems and unrest that we can face today. No, Mr. Speaker, these workshops would bring them together. Mr. Speaker, it reminded me of when I first went to the Ministry of Health as the Minister of Health, and I heard a lot about the pharmaceutical system, the drug system, exactly how it worked. I never understood it, I never worked within it. But what I did, and I found very helpful, what I did was I informed Permanent Secretary and everyone else that between 9 and 12, I was not coming at the ministry. Instead, I was going down to the drug company, the National Drug Company, and I would work hand in hand with the staff between 9 and 12, 3 days a week, so that I could understand exactly how the system works. I first started with the secretary, and I told her that I sit next to her to learn, not as Minister of Health, but I sit as a staff member so that I can learn from her. After which I moved up the system so that I understood exactly how the Bahamas National Drug Agency ran. So when individuals spoke to me and presented me with questions or concern, I understood because I worked in the system. But I worked there, though I was minister, I worked there not as minister, but as a staff. And that's what we intend to do with these workshops, Mr. Speaker, so that we'd have a better working relationship. Because once that is being accomplished, you find that our service and productivity would increase. You find that the morale of staff changes, and that's what we need. Mr. Speaker, we also notice that we must definitely improve on service. And our staff, our supervisory staff and management staff, will soon be attending Atlantis University, there at Atlantics, where they would be oriented and taught on leadership skills and human resource record keeping and accountability, again, as this would help to improve the morale and the working relationship between each one. But that staff, that senior manager who attends Atlantis University would subsequently be the pivotal point within our institution so that he or she can pass that knowledge on to the remainder of the staff so that we can have continuity, so that our entire staff would be uplifted, not only